So Matt, thanks for joining me here at the Biohackers World Conference in Miami. For those who don't know, can you just tell us a little bit about TruDiagnostic, your business, and as well as Wild Health?
For sure, yeah. So I'm a physician by training. I started a company about 6 years ago called Wild Health that does precision medicine. So we sequence people's DNA, do a ton of blood work, with wearable data, pull in millions of data points, and we built this AI-driven platform that gives personalized recommendations as what's the perfect diet for you, perfect exercise program, what supplements will or won't work with your genetics, how to optimize sleep, all these things. So that's what Wild Health is. Happy to go into more of that. And in TruDiagnostic, I'm also CEO of TruDiagnostic, which does biological age testing. So biological age and pace of age testing as well.
Okay, and I've actually done that.
Great.
Very, very cool, just in the last month. And I noticed, we spoke of this earlier, but I noticed that from what I had heard about the way you guys did the diagnostic for TruDiagnostic is different than what you're doing now. So you've made a recent change, or fairly recent change, from leaning more on the Horvath clock and telomere length to a very different, I would assume, more in-depth diagnostic. Could you tell us about that?
For sure, yeah. And as a clinician in Wild Health, I've been using TruDiagnostic for years as well for the testing, so I was already familiar. But that space, like biological age testing through epigenetics and DNA methylation, is evolving very fast. The science is always improving. Mm-hmm. So at TruDiagnostic, we have exclusive rights to a ton of algorithms. So there are dozens of algorithms that we could report on for your health. Like we can report on Horvath clock and things like this and all that different stuff. However, some of it's more relevant than others. And we used to just give kind of all the information and kind of let you sort through it because we're like, hey, let's just give all the data. I don't think that is the right approach because not everyone that gets the test is a scientist and understand what they're all for. For example, you and I were talking about the Horvath clock. People know about the Horvath clock because it was the first one, but it was trained to predict chronologic age. Well, chronologic age isn't the point. We all know how many birthdays we have. We know our birthday, or if you forgot, look at your driver's license. So we know our chronologic age. What we want to know is our biologic age. We all know people who are 80 and look and perform like a 60-year-old. People that are 40 and look and perform like a 60-year-old. And that biologic age, that's what is the number one risk factor for death and every disease. And knowing that and optimizing that is important. Horvath clock is not the right clock for that. There's also clocks for all these other different things. There's first generation clocks, second generation clocks, now third generation clocks. So we made the decision to TruDiagnostic. We have all the data, like you can access it when you do the test. We really want to just show you the most relevant things that you need to be focused on. So you're not distracted by the things that don't really matter, that are just kind of extraneous information. And those important things, there's 3 clocks that we like now. One developed by Harvard, called the Omic age test. It's the best at really predicting your mortality, how long you have to live. The second one is a clock developed by Yale called Symphony Age. And we age in a heterogeneous manner, meaning our brains, our lungs, our heart, our liver age at different rates. So this clock actually tells you different organ systems ages. And the third clock we like, which is my favorite, was developed by Duke, and it's called the PACE test. And it's a pace of aging instead of a number. The reason this is important, as a clinician, if you tell me you're chronologically 40, but biologically 36 or 44, I don't really care that much. I'm going to optimize you either way. That's what I want to do. With the pace of aging test, it's been shown to be very sensitive to change. So what this means is, like if you get pregnant, that's a physiologic stress and your rate of aging goes up 20%. When you deliver the baby, it comes back down. Same thing if you have hip surgery, get in a car accident, get COVID, your rate of aging goes up, comes back down when you recover. So as a clinician, I can do interventions with you, design these N-of-1 experiments to try to find things that decrease your rate of aging. For example, if you tell me you want to get IV stem cells in Panama, it's going to cost you $50,000. Well, how are we going to measure if it's working or not? Let's look at a pace of aging before and after. Stanford just did a twin study where they took twins and over 8 weeks they would switch them back and forth in an omnivore and vegan diet. And they used this pace of aging test and they found that in 8 weeks, changing your diet, you can affect your pace of aging. So if we want to optimize your diet and you're like, I want to try a carnivore diet, or I want to try a vegan diet, or I want to try this or that, great, let's do a pace of aging. Let's do it for 8 to 12 weeks and let's measure it again and we can dial in all of these things. You want to try rapamycin or senolytic? Great, let's do the pace of aging before and after and see if it has an effect on you. Because I don't care if a certain molecule or supplement or intervention works in a study for most people. I want to know, does it work for you? And that's what the pace of aging test allows me to figure out.
And you're saying that these interventions, someone's taking on a new lifestyle intervention, some sort of modality treatment, you can see impact in as little as 8 weeks?
That's right. Now, traditionally, we normally tell people like testing quarterly is probably good. And like we have a subscription service where like you could get a test every quarter, so you're doing things, seeing how you're going along. I test like every month because I'm always doing these things.
Sure.
I said the 8 weeks because that's what the Stanford study was. So they found a difference in just those 8 weeks. So it kind of depends on the intervention. If it's an intervention that's going to really affect your entire system, or something like stem cells, like something big like that, you can do it in a shorter window. If it's just a certain supplement or like some minor adjustments, it's probably going to take a longer time to see those effects.
So it sounds like, well, there's obviously stem cells is very new. Most people don't have access to those kind of things. We're using another person. You have to go out of the country for a lot of those special stem cell treatments. But what are you seeing that most people have normal accessibility to in the U.S. Are making the biggest impact on that pace of aging and the other metrics you're looking at? What are those interventions that seem to make the most difference?
And the reason I use the stem cells is a very specific reason. This is something that people would come to me as a clinician all the time and say, should I do this? Like, what's the evidence say? And the evidence wasn't great. But even if a study says stem cells work to reverse aging or do whatever, what a study says when it comes out in medicine is this works for 60% of people, or 70 or 80. So I want to know, does it work for you? And if you're going to drop 40 to 50K on something, like we need an objective marker.
Right.
Like, should you do it again in a few years, another 50K, or is it a waste of your time and money? So something like that is a great setup for this. Now, what interventions actually make a difference? Yale is getting ready to come out with an interventional study where they looked at that with all these clocks. So that'll be great to come out. I think that pre-pub on that will be out in the next couple of weeks.
Oh, wow.
But in general, the good news is it's the things that we kind of already thought and know, and it's the things that don't cost a lot of money. It's the lifestyle things. It's nutrition. We know calorie restriction and being in a calorie deficit state makes a big difference. Nobody likes to hear that, so that's not really great news.
Not sexy.
But exercise, like exercising more makes a big difference. Optimizing sleep, stress plays a big role. Those are the big things. Like when you look at like individual supplements, it doesn't have a big impact, which makes sense. We're complex systems. So unless you're really deficient in something, most supplements aren't going to be a big driver of optimizing your age.
So you really can't out-hack those foundational things like diet, exercise, and sleep. So it sounds like
you can supplement, you can add on,
you can layer on.
Exactly, that's exactly right.
But that's where your biggest lever is, we say, with those treatments.
100%. If you're taking all the newest molecules and supplements and doing all the newest gadgets, and you're not optimizing sleep, exercise, stress, and diet, you're wasting your time. Like just wasting your time and money. Like focus on the foundations and then layer those things on, but you can't substitute for those.
Gotcha. Now, this diagnostic test you guys are offering all over the country, and people are doing it remotely, right? So it's a simple thing people can do at home.
Yeah, very simple. So I'll talk about both Wild Health and TruDiagnostic. They're both that way. With TruDiagnostic, you go to TruDiagnostic.com, you order the test, the box comes to your house. It's a little finger stick, a few drops of blood on a card, you send it back, and you get the biologic age. Really easy. With Wild Health, so what Wild Health does is every patient we sequence their DNA. That's like your human operating system. Treating you without that is crazy to me. But your genes, your DNA is not your destiny. That only makes up about 20% of your health outcome. The other 80% is epigenetics, everything you do, sleep, all the things we just talked about. So we do a ton of blood testing. We also look at microbiome, nutrient testing. We talk to you, get phenotypic data, questionnaires, pull in data from your wearables, millions of data points, and then give you, here are the perfect foods for you. Here are superfoods, here's kryptonite foods, here's a perfect diet. Here's how we're optimizing your workout and exercise, here's how we're optimizing your sleep. All that's done remotely too. So if someone signed up at wildhealth.com for that, the DNA test would come to your house, you just spit in a tube. The blood tests, you just go to a local lab tool, we order it. All the other tests are done at your home. The imaging we schedule for you too if there's more imaging. So it's all done remotely as well.
I have to ask, what you talk about protocols for diet and exercise, what are those based on? Because there's a lot of opinions out there about the best way to eat. There's so many diets, people try different diets. I think people probably have phases in their life where they need to probably do this diet, and then to get from A to B and then B to C is probably something different, or same with exercise.
Perfect diet is not even like perfect diet for you, it's perfect diet for you right now. As opposed to you at 20, it's different.
Yeah.
So what is based on? So this is a big aha moment for Dr. Mike Mallon, my co-founder now. We started Wild Health. We saw this evidence in science around precision medicine and genomics, and we started really digging into it. When we looked at our genetics, mine and his, around food, he had all of these specific sensitivities to saturated fats and things, and really none to like carbohydrates. I had all this like carbohydrate sensitivity, none to saturated fats, and like looking at all the other things like collagen 5.1A, I needed a lot more collagen protein, like he needed more like vitamin A with BCMO1, all these things. When we looked at it, we're like, wow, it looks like we need to be on opposite diets. It looks like I need to be do really well with like a really animal heavy ketogenic diet. It looks like he needed to be on almost a vegan diet. And so we tested this with each other. And so we would eat the same thing. We would like choose his diet for like several weeks, both eat the exact same thing, exact same amounts and everything. We were kind of obsessive about this. And because we're about similar size and some age and everything else. And we do the same workouts every day. He would destroy me when we would eat his diet, and his blood work looked great. He felt great. We would switch to like the ketogenic diet from the vegan one, the animal heavy. I would start destroying him with the same workouts, and my blood looked great, and I felt great. He felt like crap. And it was just such this aha moment of like, this is why it's like religious wars when we talk about diet, because the vegans, they found the diet that works for them. The carnivores found the diet that works. Everybody's like eventually trial and error, like finds one that works for them, and they're like, oh, this is the perfect human diet. And we're like, no, it's the perfect diet for you. Like, we're very bio-individual. So the perfect diet is going to depend on a lot of things. It's genetic partly. It's also your blood work. Like, we want to see what your hemoglobin A1C, your insulin sensitivity, insulin resistance is. We want to see what your lipids are, your ApoB, because that affects that. So it's a combination. So to give you an example, my mother has a DDR SNP, meaning she probably needs more vitamin D genetically. But then we would need to see what her blood work, what is her vitamin D level? And then we need to know, is she in Florida in the summer getting lots of sunlight, or is she in Alaska in the winter? So it's a multifactorial thing to determine, like, are we just gonna recommend get out in sunlight more, or eat foods with more vitamin D, or take a vitamin D supplement?
Right.
So we collect the millions of data points, and that's why we need the AI to come up with, like, these are the perfect foods and for these various reasons. So it's a very multifactorial thing when we talk about the perfect diet for someone.
Right, based on genes, based on data. I mean, so where's the sourcing for, like, this is, I mean, I can understand with you and your partner, physician partner, that you could do some A/B testing between the two of you and see this. What's the source? I'm just curious. What's the source of this data that's determining this based on the genetic code? That's just, I'm like, where's that coming from?
The science is there. It's been there. Medicine's always just 15 to 20 years behind the science. So this was 6 years ago when we were seeing all the science. We're like, the science is pretty clear. Like, we can personalize all these treatments, not just what medications you should be taking, but supplements, diet. It's there. So that's when we started doing it and like had those aha moments for ourselves. One of my first patients was my mother. When I looked at her genetics, my grandmother had just died of dementia, and she had an ApoA4 gene that made her much more likely to get dementia, like 300%. She also was insulin resistant and obese. Put her on this program. She lost 40 pounds, reversed her insulin resistance, said she felt 20 years younger. We put Mike's mom on the program. She lost 80 pounds, got off all her chronic medications. And now we published our first several thousand patients that we've seen, and the results are just there. So this AI genomic precision medicine approach, on average, our patients who have metabolic syndrome, for example, diabetes, prediabetes. In traditional medicine, we can reverse type 2 diabetes, like normalize A1C, 3% of the time. In our patients, it's about 50% of the time that we reverse diabetes.
Oh.
When you look at something like ApoB and LDLP, or kind of bad cholesterol markers,
Right.
We reduce it with the lifestyle factors, like getting you on the right diet and all that, about 33%, which is pretty much the exact same as taking a statin. It's like we've seen when you get people on the right diet, the right exercise program, optimize the sleep for them, they just do better. Like, these outcomes that we've published on are head and shoulders above traditional medicine.
Wow, and it's personalized.
It's personalized. That's
Okay, so there's a genetic component to how our body responds to it, but at the end of the day, whether or not you get the metabolic disease or any other kind of chronic disease is an epigenetic factor.
Yeah.
So your genetics might be specific to what your modalities or specific tools you use or strategy you use, but you've got to be using those strategies in order to get the positive outcome.
100%. So we look at the
genetics. I just want to get you guys, and not to interrupt you, but the genetic component is not your final answer.
It's a part of the puzzle. Yeah. My personal belief is that even though we're a genomics-based genetics company, genomics by itself is almost worthless. Like you need it with all the phenotypic data, the blood work, talking to the person, all that. You need all that data. It's important. Genetics is about 20% of your health outcomes, so to not have it is kind of crazy. So we need it, but it's not the whole story. It's everything else that goes into it.
I see. Is there some mindset that comes into data? I mean, there's a big move now, I think, which would impact sleep, would impact outcome, but just sort of any address of attitude or meditation or those kind of things that help with the mindset of approaching your life in general.
Yeah, 100%. Those are critical. It doesn't matter how good the plan is that we give you and how tailored and personalized it is.
Yeah.
If you're not going to do it, you don't have the right mindset. I think the personalization somewhat helps with that too, though. Like my mother, she wanted to be healthy. She was trying to do things before. She just didn't know what to do. So when we finally gave her a personalized program that works for her, not only is it going to be better because it's personalized, but once it actually starts to work, then she all of a sudden has hope and isn't defeated anymore. She
feels better.
It's kind of as a self-fulfilling thing a bit too. And we talk about mindset and stress reduction a ton, and there's some really interesting even genetics around that. Like there's this gene called OXTR, it has to do with oxytocin. And when we see a specific variant of that, it means that person is actually going to respond better to loving kindness meditation than other people. So you can even tailor somewhat like what kind of meditation and things you do a little bit based on genetics, which is an emerging field. There's not a ton of science, but some really cool stuff.
What, in your example, where you said when you were doing on your diet, your workouts, you felt better, your physician partner felt less energetic, and then you vice versa when you were on his. So I would imagine that would impact adherence.
You feel better, you're going to do it. You're going to you got this positive feedback.
Yeah, you just feel better when you're on that.
And I think exercise, for him, it was the diet was the big thing. For me, it was exercise. Like I was doing Ironman training at the time when I first looked at my genetics, and I found that I had a few SNPs around inflammation and exercise that I tend to get a bigger inflammatory response, which you want an inflammatory response. It's hormetic stress to get better, but it can't be too big.
Right.
And so I needed less volume, which is counterintuitive when you're training for Ironmans. But when I did that, I started performing way better. I also found that I had a collagen 5A1 SNP, which means I needed more collagen protein. And at the time, seeing all these tendon and ligament injuries, as soon as I cranked up my collagen protein level because I saw I had this genetic need for it, I don't have those anymore, like the tendon and ligament injuries. So I became a believer because of that. I performed better and I felt better related to that kind of supplement thing and the exercise component.
And those specific tests you're talking about right now, those were in the Wild Health testing, not the TruDiagnostic.
That's right. Yeah. So that would be the kind of genetic stuff from Wild Health. And Wild Health, we use the TruDiagnostic test as well
to
optimize the pace of aging.
Gotcha. What kind of differences have you seen with the TruDiagnostic? Let's say you have a 50-year-old coming in, or whatever was the best example, like in your ideal cases, right? We can all imagine the worst, but the ideal cases, what kind of difference in aging, biological age, pace of aging have you seen, like as far as like a 50-year-old that looks 35 biologically, or what can that look like?
Yeah. So I always look at the pace of aging, which I think is the best and most critical one, because it's telling me what's going on right now. And we'll see a 10% reduction in rate of aging, which is great, because if you got 40 more years to live, you added 4 years to your health span if you keep that up. I was on the season finale of the Kardashians last season, going over these results with them, and Khloe had reduced hers by like over 20%, her rate of aging. So that's great. And then I had a patient the other day who got the rate of aging down to 0.67. So they're aging a third slower per year. So if this is a young 30-year-old, over the next 60 years, they're only going to age 40 years. They've added 20 years to their health span. So what gets measured gets managed. And so when you're measuring it and then you're doing these things, like you see improvements over time if you're kind of measuring quarterly and then doing things in between.
Wow. That's amazing. So so pace of aging you think is more important than whatever is coming across as your biological age is X.
Yeah, and the reason too, another reason I didn't mention is because like if I have a chronologically 40-year-old patient and they're biologically 42, does that mean they're doing things poorly right now? Not necessarily. I'll see this sometimes where they had maybe a really rough 20s and 30s decade, a lot of partying, maybe rehab, like all these things, and now they've cleaned it up and they're doing great. But is this like slight elevation of the age? Is it from that? And so it's hard for me to like make an intervention.
Sure.
And it takes longer, it's harder to kind of bring that down and back. But the pace of aging is sensitive to change. That's what's going on right now. That's what I can do something about more than like.
So you can see more change quickly within the pace of age with the baseline intervention, with the foundational intervention.
And it's more relevant because it's like what's going on now.
Right. You can't change what you've already done.
Exactly.
Gotcha.
Yeah.
So you can see with the interventions like we talked about, the diet, exercise, sleep, and a difference in the pace of aging in weeks, months, years. I mean, that obviously, that's kind of the idea, is to keep progressing. But what kind of, like you saw, like you mentioned Chloe, was that a difference? Like that she changed her pace of aging?
No, that was where she was right then, and that was based on she works out like crazy, does a ton of stuff.
Well, yeah, you're on TV, so.
yeah. Who knows exactly what she told me?
No, I just mean that with that kind of pressure. Like when everyone's staring at you, it's like, and some of us just have that for ourselves.
Like your job.
But as a trainer, it's like I got to do that. But it's I'm just curious with your intervention, what kind of changes you have seen in someone's pace of aging over X number of months.
Yeah. A 10 to 20% change, we see that happen, people, which is massive. That's great.
Yes.
A lot of it is genetic, so you're usually not going to get somebody that comes in at a 1.2 and take them to a 0.8, like a 40% delta. That usually doesn't happen. But the kind of 10 to 20% is very reasonable and very meaningful to make that amount of change.
In what time span?
Yeah. So it depends on how kind of hard you're going at it. Obviously, if you're using the things we know make a difference, like caloric restriction, and you're optimizing all your other things, you can see a change in a quarter or two, like in 3 to 6 months.
That's amazing.
Yeah. And that's what so the science on how often we've always said like a quarterly. But I'll quote that Stanford study that says in 8 weeks, if you're making a big change, like really changing your diet from vegan or omnivore back and forth, in 8 weeks you'll see a bit of a change as well. And generally we say give it 6 months to really take hold, because we're a whole system. Like test quarterly, but 3 to 6 months is when we start seeing the changes.
It's amazing. That's quick to see that. I mean, we are always turning over cells, and our DNA is changing all the time.
Yeah.
It's a constantly moving and evolving thing. So based on what our environment, right, and what we're putting in.
Yeah, and if you're already really healthy, it may take longer if it's like incremental change.
Sure.
It just kind of depends on
but if someone's trying to like turn, like they hit 50, boom, it's like, oh my gosh, and they get a report from their doc. They're trying to I need to change some things because I want to be not just alive, I want to be vibrant, I want to be engaged with my family and killing at my career for the next 20 years. It's like, they start making changes. They want to see improvement, which doesn't always show up on standard blood work that quickly. It can take a while to move a fasting insulin, or maybe they're doing some sort of hormone replacement at that point, and they're trying to, make those changes. But to see it in their pace of aging within 3 to 6 months, I think that'd be a great feedback and encouraging feedback for somebody who's really trying to make those changes. That's amazing.
And you mentioned being a trainer. It's the same concept. You have somebody coming in that's like completely deconditioned. They make gains pretty quick. It's impressive.
Yeah.
And so it's the same thing with this. It depends on where you're starting from.
Absolutely. No, I understood that. Yeah, that makes complete sense. Matt, tell us more how people can find out more about both Wild Health and TruDiagnostic. How can they find you guys?
So wildhealth.com is where you can find out everything about Wild Health, or become a patient or anything like that. TruDiagnostic.com is where you get the True Age test. We have a brand new test we're launching in a month, which I think is the most exciting thing in medicine. We don't have time to go over it in depth right now, but it has to do with like what else you can test with epigenetics. It's going to be a big report called True Health. It's going to give all these other biomarkers, not just your pace of aging as well, to then tell maybe not just how fast you're aging, but why, like what's off and what do you need to prove. improve very specifically. So just in the next month, that's coming out.
So that's going to be part of that, or it's going to add on?
It's a different test.
Different test.
Yeah. So not only like what is your pace of aging, but why? What exactly is going on? We found that with epigenetics, by looking at these million gene sites, how much every gene is turned up and turned down, you can not just tell your biologic age, but you can tell about all these other biomarkers.
So why, as in whether it's your diet, whether it's fitness, whether it's sleep, what's impacting that? Is that what you're saying?
Yeah. So biomarkers. So just like if you were to go to LabCorp and get 200 biomarkers drawn to see like what's going on, what do I need to do? Same thing. You get the like kind of traditional biomarkers, but through epigenetics.
The impact, like what's having the impact.
Exactly.
It's amazing.
Yeah.
Thank you, Matt. Appreciate your time. Appreciate you joining me here. I'm looking forward to that updated test.
Great. Thank you.
Unlock your full potential at the Biohackers World Conference and Expo in Los Angeles on March 29th and 30th. Connect with leaders in health optimization, learn the secrets to longevity, boost your performance, and dive into the latest biohacking and wellness innovations. Don't miss out. Tickets are going fast.